Hello, I'm Sana Khan, and you're watching Medicircle. Today we have with us Dr. Syed Perveez. He is a senior business leader with close to 2 decades of experience handling large operations and delivering balanced performances across costs, productivity, quality, and HR parameters in the service industry. Please welcome him to our show, Rendezvous on Patient Safety Series. Hi, Dr. Syed, how are you?
Hi, good morning. I'm fine, Sana.
Okay, so to begin with, patient safety is a global health priority, hence proved by COVID. What are your thoughts on the same?
Well, patient safety is the most important one because, as we know, the whole world has been swept over with this COVID-19.
Right.
It's an experience that we never had it for at least, I think, last 100 years or something.
Mm-hmm.
It all struck us, overnight. And then
True.
some of us took time to even think what it is. And finally, it came to us. And then the thing is, on one side, there is patient safety. On the other side, there is also the, hospital staff safety also, because we
True.
have to keep both of them safe. The diseases can spread either way.
Mm-hmm.
So most important thing is hospitals have to develop protocols, and I'm sure they have developed already by now, but they have to stick to it. They have to ensure that first thing is that the patients, whoever is in contact with the patient in the hospital, the safety, right from the watchman to the housekeeping staff, to the nurses, to the ward boys, everybody has to be briefed properly so that there's no issue left open. Nothing should be left in the open. It's like everybody's educated, everybody knows that life is important for them first, because this virus is something that they carry back home, and then they can pass it on to other people. That is
True.
one.
Very
And
true.
second thing is the patients who come in, they have to really maintain proper care of them. They have to guide them also how to be safe, and they have to take them to the earmarked wards only, because every hospital has dedicated certain wards to them. There are fever clinics that are set up. So this whole thing has to go in synchrony, and that is when we can ensure that the patient and the healthcare staff safety both is achieved.
Very true, sir. The theme for this year's Patient Safety Day is Safe Health Workers, Safe Patients. What is your contribution towards the safety of the health workers?
Yeah, what we do at our hospital is that we ensure that everybody is first of all briefed. Yes, all of them have been put through a day's training as to what exactly is COVID, how they have to keep themselves safe, and all of that.
Mhm.
And we have provided the PPEs, the personal protective equipments, the sanitizers on all the floors and all the departments. They all are given gloves that they wear, and then there are masks that are provided by the hospital. So
Mhm.
all these things are done religiously, and we also supervise. We go on rounds, and we ensure that everybody, because the first 1 month it was very crucial, because people are not in the habit. People wear
Right.
masks. They say they used to laugh at it. They're like, "What is this mask? I mean, why are we wearing it? Nothing will happen to us. God is there," and all those kind of things. So we had to really drill it down into their head that this is not how it works. And then finally they started complying with it. And there came a time now also we are ensuring that we go on rounds and we ensure that everybody is protected well, and thereby even the patients. Now there are attenders who come, patients attenders. Sometimes they are careless. They are like, what will happen to me? There's nothing, and they pick up a fight with the security guy and all of that. So we have to educate them. There's a people that are located at the reception who talk to such people, and who calm them down and who educate them, who tell them that this is the thing, you should not take the risk back, and all of that. And things are falling in place. I think 99.9% we are very well within the compliance. Probably a
That's nice.
0.1% here and there,
Mhm.
we wouldn't know. So we are giving prime importance to patient and the healthcare safety, because both of them go hand in hand. Now the
True.
patient brings the virus to the hospital, and it is not like he comes to spread it. He has to come to get cured, and he has to go, because the hospital vision is care and cure both. It
Mhm.
cannot be just like just caring and or curing. It is both. You have to care them, and also you have to care for your own people. That is most important, because even if one person contracts the disease, all of them get scared, and people will start applying leave. People will start running helter skelter, all those things.
Mhm.
So it's very important that we focus on both of these, and we have been doing it.
This is the digital age, and healthcare is highly influenced by technology trends. How do you think this transformation will support patient safety today?
Well, technology, there are a lot of things need to be done, because technology can really be leveraged in the hospital setting to a great extent. And abroad in the Western countries, they have done it all. Now the thing is, how you use the technology is the most important thing. Like for example, the patient registration, it can happen without any contact. You just put on a
Right.
kiosk, and then the patient's attender or somebody can just punch in the details, and then the patient ID card can come in. Like that, we can start off, and we can ensure that. And there are also multi parameters now. People need not touch the patients to go and check the blood pressure or the temperature, whatever. There are multi parameters are there. You just hook it onto them, and or you just guide them to go and sit in that particular kiosk, and then they sit and they get their report. Even the ECG also is possible. The temperature, the weight, the ECG, the SpO2, all of these things are generated automatically. So that's another one. So like this technology plays a major role. We can put it in various other aspects as well, like even for example prescription. It can be typed on the computer, and a printout could be given to the patient. You don't need to
Yeah, the
literally sit and write.
e-prescriptions available these days.
Yeah, e-prescriptions.
Hmm.
And what happens there is, you don't have an issue with the handwriting, because what happens normally is the doctors just scribble because they are in a hurry of time or they're not used to writing,
Right.
and the pharmacists just give a blank face. They say we don't know. So these are all the things, areas where technology can really go a long way. It'll take time because not all hospitals are equipped, first of all, and
Right.
not all hospitals make up their mind as well.
Mhm.
Sure, slowly but surely, yes, we're going to be there.
Diagnostic errors, healthcare acquired infections, medication errors, readmissions, wrong site surgery, and communication are the major patient safety issues. How do you ensure proper patient safety in these cases?
Yeah, this is a very key thing now, what you brought up. The thing is, unless you don't have quality management system, a QMS you don't have in the hospital, and that is not imparted to all the hospital staff. Now, what in my experience I've seen is people get NABH accredited for the accreditation's sake, but nobody follows it. It
Nobody
has to
follows
go
it.
down till the last person. The last person has to understand why we are doing something. You have to believe in what you're doing. If you don't believe in it, you don't do it. You don't work in the hospital. If you don't like it, you don't work. Like for example, if you talk about the nurses or whoever it is, we all are working towards a shared vision, and we've got a common vision in mind. That is to ensure that the patient is actually a customer. That's the way we have to see. We cannot see a patient as a helpless person
True.
who's just coming and he's at our mercy. Now that is
Mhm.
sadly the issue with most of these small hospitals. They don't understand that patient is a person who's bringing you revenues, so you better respect him. And Mahatma Gandhi has said the most important words, that patient is the most important person at your premise, nobody else. So patient has to be treated with the importance that he has to be. So start treating the patient like a customer. How a customer comes into a service industry, how he's, for example, if you see a five-star hotel, the way he's received and the way he's respected, there shouldn't be anything short of that at a hospital, because he's got a problem that means business to you, and he's bringing business to you. At the same time, he expects cure for him in a very
Right.
sophisticated manner, in a humble way. If you don't do that, if you start saying that I'm a doctor and I'm close to God, and I can just hang up my legs and I can sit and I can take him for granted, that is not the way. So that being the case, all the staff at the hospitals also have to be told that, see, first of all, if a patient comes in, we should assume, or at least we should empathize with him, saying that what if he had to be one of our family members? It's possible, right? Anybody could be there. And when our family member is there, I could see the hospital staff, they go head over heels, they want to get all the best attention for them. But then when some other patient comes, they are like, oh, patients keep coming every day, so what's the big deal? And if there's one person who is the health staff's relative, I've seen it, the way they get nervous, the way they jump around, they are like, they don't eat food. They're like all the time behind the patient's, patient, because it's somebody blood related to them. So
Right.
blood relations makes all the difference. So we have to start. It's time, I think. I think the big hospitals are doing it, but all of them across the globe, they have to start thinking that a patient means a customer. A customer has to be respected, and then all these things will not happen, the diagnostic errors or
Through
the
the
wrong site surgeries and all of these, because protocols are followed. See, if a patient is moved into the operation table, and if the clear site area is not earmarked, then how would the surgeon who comes in will figure it out? It could just be a small laziness from that nurse or OT nurse or whatever.
right.
She just in the wrong presence of mind or absence of mind, she just marks the wrong site. And she better will not do that, because what if it had to be, let's say, an extremity, her own hand or leg, if it was on the operation table, or her own brothers or fathers or something? It would have been of utmost care, right? So that's the way it is. So protocols have to be followed really clearly, and it's been followed. A few places here and there are errors that we also have to address. We have to take that sense that A patient is not at our mercy, we are at the mercy of the patient. That should be the motto.
I hope everyone follows what you just said. So we will definitely reach the standards.
Absolutely.
Thank you so much, Dr. Syed, for coming to our show and sharing your insights for our patient safety series at Medicircle. It was a pleasure having you here.
Thank you so much, madam. Wish you all the
Thank you
best.
so much. Have a good day.